Hi, Dr. Pelto here. I want to do a little presentation for my patients about what to expect with Swift therapy. So Swift therapy we're using in the office to deal with warts on the bottom of the foot. These are different examples of plantar warts. I want to kind of go over some of the common questions that patients have. So first of all, Swift microtherapy, it helps to speed up curing warts by 50%, and it's about 85% effective with less than 1% recurrence. So we're going to talk about a few things about recurrence and things like that. A lot of times you can avoid this with Swift. It really speeds things up because some of the traditional treatments can take 10 treatments or more. How does it work? Well, it uses low dose microwave energy that's delivered to the skin. The tissue temperature is rapidly elevated, creates an immune response. This is a key to any treatment, it's immune response. So your body attacks the virus, it resolves it, and it's usually done in 3 to 4 treatments. And they're done 4 weeks apart and then a 3-month follow-up. And so we're going to kind of go over what you would expect every time. I'm going to talk about how Swift works. Well, I already did that. I said that it causes an immune response. What to expect. So basically you'll come in. We might trim the skin a little bit. It's not necessary, but if there's some really thick callus, we might trim that if it's uncomfortable. I tend to squeeze the foot and then I apply the dosed energy. You're going to see results. Maybe not until the 2nd or 3rd treatment, so that might be 2 or 3 months away, but some people instantly feel a little bit better. How many treatments? Usually it's 3 to 4 treatments, which is a lot less than traditionally, which is about 10 treatments, using like salicylic acid or cantharidin or other laser treatments. There's no restrictions after treatment. That's a nice thing. And then how can I tell if your immune response starts? It's because the wart almost falls off on its own. And if it doesn't work, you can still try some of the other treatments or surgically remove the wart. And then how to prevent recurrence? Well, we're going to go over that a little bit, but there's not much recurrence with this treatment. So here's an example. I'm using the Swift machine right here. And here's the wart. So what I do is I tend to, I trim off a little of the hard skin. So there's 2 warts. So I do 6 little applications, and each of them are 2 seconds. You can kind of see it says 2 seconds here. And then I have the wattage, which is between 8 and 9 joules. That'll kind of go into that area. And I do 6 treatments for 2 seconds. So you'll hear a beep, beep, beep. And then 2 seconds later, another beep, beep. So what's going to happen? It's going to go beep, beep. And then it'll get really hot and then beep, beep, and then it'll calm down. So there's kind of that really high curve where it's going to get really warm and then calm down. I reset the timer. I go and turn the knob for another 2 seconds, do it again. And I do that 6 times, okay, on each wart. So I do 6 here, and then I would do 6 here. I don't go back and forth. I find a couple of things that help. Holding it very lightly on the skin makes it hurt less, and also squeezing the skin, and even having patients recognize that there's no pain afterwards, that helps people, okay? Here's an example of the machine. So I turn the watts usually to 8 to 9 watts for 2 seconds, and I go back and I have to reset this every time. If you pull away, what's happened, there's going to be a reset button that'll go on, and I'll have to reset it. Here's kind of how it works. There's the wart that's in there. It uses the microwave energy to kind of go down there and heats the skin to between 43 and 46 degrees Celsius in those six times. So each one, it kind of increases, and it gets rid of the warts, and it helps stimulate heat shock proteins within the human papillomavirus to kind of clean off themselves. Kind of goes away. Kind of seems like magic now when I'm doing it. So here's an example of before and after. A whole bunch of warts. They kind of all went away after 1 month. Really big wart with a callus. So something like this, you would want to trim down that callus because it's painful, and they've kind of gone away. Warts on the bottom of the heel right here. Those as well has gone away. And here are different ones. So wart on the heel right here, on the toe kind of goes away, a big one. And then here's kind of the progression. So there's different types of warts. How to prevent it? Well, if it's in the same location, it never was really gone. If it's in a new location, then it's a new issue. And then you want to examine your feet periodically. You want to prevent sweating. If you want to learn more, if this was helpful, and you're not already a patient of mine, we have a little booklet we put together. You can get it at fixmywart.com. It's the ultimate guide to wart treatments if you want to learn more about treating your wart. Okay. Once again, hope this was beneficial for you, and we'll talk later. If you have any questions, just post them underneath this video.